Hello and welcome. Thank you for joining this video series to learn about Medicare and your insurance options. My name is Kelly and I'm with the Community Care Marketing team. This video series is presented in chapters so you can jump to the information you need. For those of you that are new to Medicare, it's best to start at the beginning. If you would rather attend a full seminar in person, go to the seminar registration page on our website and find a meeting near you. And of course, our Medicare sales team is available to help you as well. Just give us a call. Here are the topics we'll be covering. Medicare, when and how to enroll, original Medicare premiums and benefits and what it doesn't cover, your options for additional coverage, which would be Medicare supplements and Medicare Advantage plans. Then we'll talk about senior health plan offered by Community Care Choice. We'll show you the benefits included in our most popular plan levels and then go over your enrollment timelines. And of course, my team is here to help you. The phone number will be visible throughout this presentation, or you can click the Contact Us button to send us an email. Community Care is your local insurance provider, and we're here to help you in any way we can. Let's get started with Medicare. In this section, I'll talk about Medicare, what it is, when to enroll, how much it costs, and what it covers. Obviously, I can't go over every possible situation and circumstance, but I'll give you the basics, and if you need more, call and talk to one of my Community Care teammates, and we'll get you the information you need. So, people are generally eligible to enroll in Medicare when they turn 65. Some people are eligible due to a disability, but for simplicity, we'll talk about those that are aging in. If you're turning 65 and are not covered under an employer plan, either as an active employee or the dependent of an active employee, you will need to enroll in Medicare A and B. If you're still working or covered by someone that is, and have insurance through your employer, you may be able to delay your Part B until you leave your employer coverage. So, if you have questions about whether or not to delay enrolling in Medicare, you can call us and we'll help you find the resources that you need. Okay, let's move on to how to enroll. If you started collecting your Social Security or Railroad retirement benefits early, you will be automatically enrolled in both Medicare A and B. Remember that if you're covered under an employer plan, you can delay your Part B. If you did not start your Social Security benefits early, you should take action before you turn 65. You can start the enrollment process as early as 3 months before your 65th birth month. You enroll in Medicare through Social Security. You can enroll online at ssa.gov. Select Medicare from the menu and you'll find the Medicare application. You can also enroll at your local Social Security office. If you're over 65 and retiring, you will have an extra step. You'll need to apply for Part B and provide proof of coverage in order to enroll and avoid penalties and waiting periods. Call my team and we'll get you the forms and the information you need. Now let's talk about the cost of Medicare. For most people, there's no premium for Part A because you paid for that with your payroll taxes. Part B does have a monthly premium. If you're receiving your Social Security or Railroad retiree benefits, your Part B premiums will be withheld from that. Keep in mind that Part B premiums are higher if you are a high-income earner. You'll be notified if your premiums have an income adjustment. You can also find more information about the rules for high-income earners on the Social Security website. So that's what original Medicare costs, but what does it cover and what are your out-of-pocket costs? Part A is the hospital coverage and Part B is medical. Part A would cover things like an inpatient hospital stay, hospice, skilled nursing. Part B covers medical services, doctor's visits, durable medical equipment, outpatient surgeries. Together, Part A and Part B are original Medicare. So if you only have original Medicare and need medical services, you'll have deductibles to meet, and then a 20% coinsurance. And there is no limit on your out-of-pocket costs. If you have a lot of medical services during a calendar year, that 20% can really add up. There are also limits on the number of lifetime inpatient days you have and no coverage for medical services outside the United States. And there's no coverage for routine dental or vision exams, hearing aids, outpatient prescription drugs. So people generally want to add some type of coverage to their Medicare. That's what we'll cover next. You'll have a couple of different options to add to original Medicare. One is a Medicare supplement plan or a Medigap plan, and the other is a Medicare Advantage plan, also known as Medicare Part C. We'll start with Medicare Supplement or Medigap plans. As the name suggests, these plans supplement original Medicare. In other words, Medicare pays first, then the supplement will pick up most of the balance. But If Medicare doesn't cover a service, the Medigap plan generally doesn't cover it either. So you may still lack coverage for things like dental and vision care. And you also still don't have coverage for your outpatient prescription drugs. Those are covered by a Part D plan, which is a drug plan that you can purchase from an insurance company. Some people choose a Medigap plan for the freedom it offers. You can see any doctor that accepts Medicare, and you have a lot of options for your medical services. But that freedom does come at a cost. When you have freedom to see any doctor you choose and very little out-of-pocket expense for your medical care, you'll pay for that in higher premiums. In addition, the premium for a Medigap plan is generally based on your age and sometimes your health conditions. So that means as you get older, your insurance premiums continue to rise. And if you couple your Medigap plan with additional insurance plans like dental and vision and a drug plan, that's a lot to keep track of. So let's move on to Medicare Advantage plans, or Part C plans. A Medicare Advantage plan combines the original Medicare benefits and usually your Part D benefits under one umbrella, and they often include additional benefits for routine dental and vision coverage and more. Medicare Advantage plans are contracted with Medicare to administer your benefits. What that means for you is that the plan pays your claims. Medicare pays the insurance company a monthly fee when you join and no longer pays your medical claims. What you'll find is that a Medicare Advantage plan feels very familiar. When you go in for services, you only show your plan ID card. You put your Medicare card away. And you show the same card for all of your covered services: medical, dental, vision, pharmacy. One plan, one card. Medicare Advantage plans typically have a low or no monthly premium, and the premium is the same regardless of age. In fact, the same plans are available regardless of your age. If you have Medicare due to a disability, you're eligible for the same Advantage plan as those that are age 65 or older. The premium is the same regardless of your age or health. Now, because the monthly premiums are so low on these plans, there is a trade-off. With Medicare Advantage plans, you will have some cost sharing for most of your medical services, and you generally have a network of doctors that you have to use to maximize your benefits. Eligibility to join a plan is also based on where you live. Medicare Advantage plans generally are contracted to sell their products to residents of certain counties. Your insurance choices are personal and can be complicated. You'll want to look at your provider choices, what hospital systems you're most comfortable with, and what you can afford as far as monthly premiums or out-of-pocket costs, and what additional benefits are important to you, as well as your prescription drug costs. It's a lot to navigate, and my team is here to help you find the best fit. Now that I've shown you the difference between Medigap and Advantage plans, let's talk about Community Care Medicare Advantage plans, Senior Health Plan HMO. Community Care is Oklahoma's largest locally owned insurance company. Our main office is in downtown Tulsa, and we have a satellite office in Midtown Tulsa at 47th and Harvard. We live and work in the community with you. Community Care is owned by Ascension St. John and St. Francis Health System. In fact, we have the only Medicare Advantage plans that are contracted with both of these premier health systems. This means that when you join Senior Health Plan, you have in-network access to both St. Francis and Ascension St. John. Now, Senior Health Plan is an HMO. That means you must get your care from network providers for the plan to work. In other words, you cannot choose to see doctors that are not contracted with Senior Health Plan. This usually is when we get the question, so what happens when I'm traveling? The answer is, you take us with you. With Senior Health Plan, you have worldwide coverage for both emergency room visits and urgent care, just as you would when you're at home. So with our plan, you have peace of mind to know that regardless of where you are, you can still get the care you need. So now let's look at your options with Senior Health Plan. You'll see here that we have 3 plans that include both medical and Part D coverage and 1 medical-only plan. Most people need a plan that includes both medical and Part D, so we'll cover those first. Our most popular plans are Silver Plus and Platinum. You'll see here a comparison of the plans. The Silver Plus plan has no monthly premium. Now it does have higher copays for some services and a higher maximum out-of-pocket. So let's talk a little about what the maximum out-of-pocket is. This amount is the most you will pay during a calendar year for your covered medical services. It's an accumulation of your copays throughout the year. Once you reach that maximum out-of-pocket limit, Community Care pays the rest of your covered medical services in full for the rest of the year. As you're looking at this chart, keep in mind that regardless of which plan you are on, you pay nothing for covered preventive screenings. You'll see the copays for primary care and specialists, urgent care and emergency room. The chart you see here shows the more common benefits on our Silver Plus and Platinum plan. You'll see here that the copays on these two plans are very similar. In fact, you have no copay for primary care doctor visits. You've got very low copay for specialists. You'll also see that our emergency room copay is $90 for both of these plans. And keep in mind that if you have an emergency room visit and you're admitted as an inpatient within 48 hours, that copay is returned to you. There's not a lot of copay differences between the Silver Plus and Platinum plans, but I do want you to look at the medical maximum out-of-pocket. This is an accumulation of the copays that you may have throughout the year. And if your out-of-pocket for your medical services reaches that medical maximum out-of-pocket limit, Community Care then pays the rest of your covered medical services in full for the rest of the year. Silver Plus and Platinum also include additional benefits that Medicare doesn't cover. We'll go over those after we talk about Silver, the medical-only option. These are obviously the more common benefits that most people use. If you have questions about specific copays or need more information, be sure to reach out to the Community Care team. Let's shift to prescription drugs. This can be a big factor to consider when you're deciding on your health insurance options. Regardless of how you get Part D coverage, whether it's a plan like ours where the Part D is included or it's a standalone drug plan, they all have these 4 stages. Our plans do not have a deductible, so when you start with us, you are in the initial coverage level where you pay a specific copay for your prescriptions. Here are the copays for a 30-day supply of your prescriptions. What you pay depends on what tier level your drug is in. It's important to check the plan's formulary for your maintenance drug so you'll know what to expect. You can also save money if you order a 90 or a 100-day supply of your prescriptions. On our plans, you can actually pay nothing for an extended day supply of your Tier 1 and Tier 2 drugs. Most people stay in the initial coverage limit throughout the year, but there are other stages of Part D coverage that you need to be aware of, and they're based on your total cost of your prescriptions. We send you a monthly statement that keeps track of your total drug cost. This is what you pay plus what we pay, and if you reach the initial coverage limit, then you move into the coverage gap, or the donut hole, where you pay a percentage for most of your prescriptions. The next stage of drug coverage is the catastrophic level. Moving to this level is based on your total drug out-of-pocket costs. These are the copays you paid at the beginning of the year, plus what you paid in the gap. If you reach that level, you move into catastrophic coverage where you pay a reduced cost for your prescriptions, and that carries you throughout the end of the year when everything restarts. A word about this. Social Security does have a program called Extra Help or Low Income Subsidy. Eligibility for this program depends on your income and somewhat on your assets. The income limit is not as stringent as it is for Medicaid, so we encourage anyone that is struggling financially to contact Social Security to see if you qualify for this program. You can apply at any time. If you do qualify for the Extra Help program, you'll see a reduced premium for your plan and lower drug costs. So now let's look briefly at our Silver plan. This is the plan that does not include Part D. Many people on this plan have access either to Indian Health or veterans benefits, so they don't necessarily need a Part D plan. But we do have many members on the Silver plan that just don't want a Part D plan, and that's fine. Anyone can enroll on a medical-only plan, but we do want to make you aware of 2 things. Number 1, you cannot add a standalone Part D plan to this Silver plan. And number 2, if you don't have a Part D plan when you are first eligible for Medicare, and you don't have credible coverage through another source like VA or Indian Health, you will be penalized later when you do enroll in a Part D plan. So be mindful when you're making your choices about your drug coverage. Okay, so here are the common benefits of the Silver plan. This plan covers the same medical benefits as Silver Plus and Platinum, including worldwide emergency and urgent care. Community Care's Medicare Advantage plans cover additional benefits that you wouldn't have with original Medicare. Our plans include coverage for preventive dental, routine hearing and vision screenings, even rides to your doctor. With our non-emergency transportation benefit, you can call our customer service reps 2 days before your appointment and we'll schedule a driver to take you to and from the doctor. It's a $5 copay, whether it's one-way or round trip. You'll also see that our Platinum, Platinum Plus, and Silver plans include a hearing aid benefit as well. Now let's talk about a new benefit for 2021. This is our wallet benefit. You'll see here our chart that shows the benefits for Silver Plus and the Platinum, Platinum Plus, and Silver plans. The wallet benefit has a maximum dollar limit that you can spend on the benefits you'll see here on the chart. Our wallet benefit includes things like fitness memberships, personal emergency response devices, comprehensive dental, home safety devices, and more. The way this plan works is a reimbursement program. Simply submit the wallet benefit claim form with your proof of purchase and we'll reimburse you up to your wallet benefit limit. But if you do need more information about the wallet benefit, any of the additional benefits, or anything on our Medicare Advantage plan, feel free to call my team at the number you see on your screen. And that's a look at Senior Health Plan. Again, I showed you the more common benefits. If you need more information, call my team and we'll be happy to help you find all the answers you need. Now let's talk about how to enroll. Generally, when you enroll in a Medicare Advantage plan, you're locked in for the calendar year, meaning that other than some special circumstances, once you choose a plan, that's your plan for that calendar year. So you want to make sure that the plan is the right fit for you. The two things we recommend people look at when selecting an insurance plan are, number one, is your doctor in the network? Remember that our plan is the only Medicare Advantage plan contracted with St. Francis and Ascension St. John Health Systems. So if you use doctors in either of these systems, or if this is your preferred hospital, Senior Health Plan will be a good fit for you. Number two, what are the costs for your maintenance drugs? Once you have those answers, you're ready to make your selection. You can submit your application for Senior Health Plan up to 3 months before your effective date. The application process is easy. You can download an application form from our website, call us to request a form, or come see us at our satellite office at 4720 South Harvard, or the easiest thing, simply call us and we can enroll you right over the phone. We're happy to help and we'll make the shopping and enrollment process as painless as possible. Thank you for visiting us today. Choosing your health plan is important and personal. Call us or come see us if you have additional questions or register to attend a seminar at a location near you. We look forward to hearing from you soon.